Hi, I am Dr. Katie Lee, and I am the CEO and founder of Collective Health Society. And what really inspired me to set up this clinic was I started noticing that all of my patients that had severe dental disease also had several chronic disease conditions that they were suffering from. And oftentimes, what I would send these patients to their healthcare providers for follow up testing and care. They either didn't have a provider on their team that would treat certain systemic issues, or I would send them and their provider would say, we're unsure why this dentist is getting involved in these kind of systemic conditions. So it was really my dream to open up a one-stop shop for patients to be able to come in and receive all their dental and medical care in one location. Our approach here at Collective Health Society is different from traditional dentistry in that we take a very precise, personalized approach to everyone's healthcare. One major thing that we do when patients come in is we do salivary microbiome testing. This allows us to know what bacteria in the mouth, if they're affecting systemic conditions, and then how to best treat them. The other thing that we really focus on is making sure that everyone has a healthy airway and can breathe properly. Nasal breathing is so critical for our overall health and wellness, and so we want to make sure that our patients have healthy airways. And then the last thing that we do is we make sure that we are utilizing or placing biocompatible materials in our patient's mouth and removing any toxic metals. That way, patients aren't being slowly poisoned over time by what's in their mouth. Patients can receive all sorts of healthcare under one roof here at Collective Health Society. The main thing is that we are just a regular dental office, so patients can receive their cleanings, they can receive crowns and fillings. We also do oral surgery, Invisalign, any kind of cosmetic work that you would receive at a traditional dental office. We just do things in a more healthy, biocompatible way. We also have a nutritionist on staff that will help our patients eat well. She also tests if patients are suffering from any kind of food sensitivities or if they have toxins or parasites in their system. We offer IV therapy to help our patients detox from all of the toxins in the environment and also receive nutrient and vitamin therapy. We have a medical director in case patients need primary care. And then we also offer myofunctional therapy, which is like physical therapy for the mouth. This helps with all kinds of things like tongue posture and airway and breathing as well. So, what makes our diagnostic approach more effective at finding the root causes and getting better outcome is that we actually are testing our patients for what is going on in them. So, we use salivary microbiome testing to figure out what is it that's causing the gums to bleed, or what is it that's actually causing the patients to get cavities. And then, based on what we find, we tailor our treatments. That way, patients are getting the right treatment for the issue that they're receiving. When you do this approach, patients get outstanding results. So our office is filled with all of the latest and greatest technologies. We use all digital x-rays in our practice, which offers the lowest dose of radiation available on the market. We do 3D CBCT imaging, which means that we take three-dimensional x-rays of jaws and of teeth. This allows us to see the airway. It also allows us to see issues that are on teeth that otherwise are invisible on traditional dental x-rays. We do salivary microbiome testing to test the bacteria in people's mouths. We do enzyme testing to test for systemic inflammation. And then we also have a machine in our practice that will mill same day crowns and ceramic fillings, which is a very biocompatible material, so no more temporaries. And then perhaps my favorite piece of technology that we have is actually an ozone machine. So we use ozone in all of our dental cleanings to help reduce the bacteria in the mouth. We also use it as part of our oral surgery and our implant placements as well to help with wound healing. So, a lot of people don't realize just how connected the mouth is to the rest of the body. For instance, the mouth is directly impacting over 57 systemic diseases. And when we see something going on in the mouth, it's oftentimes a mirror to something else that's going on. So, I always tell my patients, I can treat what's in the mouth, but in order to get you optimally well, we need to partner with another provider, such as a naturopathic doctor or a functional medicine doctor. That way, they can treat the rest of the body. And then together, we can help reduce chronic symptoms that patients are suffering from. In our office, we have several different membership plans that patients can sign up for. We have a dental membership plan that helps make what I do in dentistry more affordable. We have functional medicine membership plans. For functional medicine, we also offer nutrition testing and plans as well. And then we also do IV membership plans. That way people can get multiple IV vitamin treatments a month if they wish. We'd love to see you here at the Collective Health Society. Please go to our website at www.collectivehealthsociety.com and you can book an appointment with me or any of my other providers directly on the website, or you can give us a call at 303 223 2343.